One of the things we see children for would be recurrent tonsillitis. And tonsillitis would obviously be an infection of the tonsils. Many people use the word strep throat. Strep is one of the bacteria that can cause a tonsillitis, but not all episodes of tonsillitis are strep. But a tonsillitis would be a bacterial infection of the tonsils. As far as determining when do we need to remove tonsils versus follow them, there are some guidelines that were released by our academy as far as numbers that we use. And on the low side, the numbers that we use would be 3 or more infections per year for 3 or more years. Now, if they have 6 or 7 in 1 year, that's a whole different ball game. But if they're having three or more per year for 3 years, we definitely recommend removing them. Another thing we see with tonsils is sometimes they're just big, and they may have never had an infection, but the family doctor or dentist notices that they have big tonsils, they snore, and so they are seen by us. When we see that patient, they don't necessarily have to have their tonsils taken out, but if they have other symptoms, we do, such as when they're sleeping, if they're snoring and gasping for air, that would be a reason to definitely consider removing their tonsils. If they snore and make a little bit of noise, but they're breathing comfortably, then many times we will just follow that patient. Well, when we remove tonsils, that is a significant procedure for parents. One of the things that I talk to parents about, many times they say, well, do they need their tonsils? And in that, there's a study that came out a few years ago that showed that the tonsils and adenoids, if you need them, first year of life. After that, they're not really beneficial for you. So if you remove your tonsils, it's not like you're going to be missing out on some kind of protective mechanism. We try to talk to them about how the recovery is going to be. Unfortunately, there is pain associated with the recovery, but we have medicine for pain and nausea, and then we try to talk to them about things that are good to drink and eat. I recommend no crispy or crunchy foods for a 2-week period. Now, the good stuff they can have, ice cream, popsicles, mashed potato, mac and cheese, pasta, those are all great. Things that can be tough on them would be orange juice, tomato-based products, anything that's got a little acid, if you will, in it can sting. It doesn't hurt the operation, but it kind of stings. So we try to have them avoid that. Pretty much any meat or vegetable is fine whenever they're ready for it, as long as it's not crunchy. So they can eat many things when they're ready, but starting out with the ice cream and popsicles is kind of the way we start. And then as far as the pain medicine is concerned, we do give them liquid pain medicine so we can adjust the dose in the children as they need it during their recovery.